Most nurses working in community care are actually building someone else's business, and they don't even realize it. Because the clinical knowledge nurses use every day is the foundation of how home care services operate, community nurses manage clinical risk, coordinate care teams, monitor changes in condition, and often prevent hospitalizations before they happen. That expertise is incredibly valuable, but in most cases, nurses are applying those skills inside organizations they don't control. Quick question for the nurses watching this. If you've ever wondered what it would look like to build your own home care service, just comment "nurse" below. I'll send you a resource that explains the pathway many nurses are using to transition from employee to business owner. Now here's something interesting. Many community nurses I speak with say the same thing. They genuinely love working with their clients. But the system they work in often makes it harder to deliver the level of care they know is possible. Large caseloads, tightly scheduled visits, and service planning that is often done by non-clinical staff who may not fully understand what an RN actually needs to do during a visit. For example, wound care. Sometimes wound care is scheduled for a 15-minute visit, but as nurses, we all know wound care isn't just changing a dressing. It involves assessing the wound, reviewing the client's overall condition, cleaning the wound, applying the correct dressing, documenting the treatment, and monitoring healing progress. All of that takes time. But when people without clinical background are scheduling services, they often assume wound care simply means cleaning and redressing the wound. That misunderstanding creates pressure on nurses to rush through clinical care. It also means there's very little time to talk with the client and properly assess their overall health condition. In many cases, nurses are expected to complete complex clinical tasks within timeframes that simply don't reflect what safe practice actually requires. At the same time, many non-clinical managers focus heavily on billable hours and reducing what they call non-billable nursing time. But the reality is that many of those so-called non-billable activities, assessment, clinical judgment, and monitoring subtle changes in a client's condition, are exactly what keeps clients safe. Those moments are often when nurses notice early signs that something isn't right. But when schedules are built around efficiency rather than clinical care, those important observations can easily be missed. And that raises an important question. Are these systems really designed around the realities of clinical care? Do they truly understand what safe nursing practice requires? Do they fully appreciate the role nurses play in protecting client health, safety, and well-being? Most nurses already know the answer to those questions. And at the same time, the clients we care for are becoming more medically complex every year. Many nurses feel like they carry huge clinical responsibility, but have very little control over how care is actually structured. And that gap between responsibility and authority is one of the biggest reasons nurses experience burnout in community care. One thing that often gets overlooked in home care is just how much value nurses actually create. When a nurse identifies early signs of deterioration, when medication issues are caught before they become serious, when fall risks are addressed early, those actions can prevent hospital admissions, and preventing hospitalization is one of the most important goals of the health system. So nurses are not just completing clinical tasks, they're actually managing safety and preventing deterioration across the entire care system. That kind of clinical oversight is incredibly valuable in home care. But here's something many nurses don't get visibility into. Home care services are actually structured around the exact type of work nurses are already doing. Providers receive funding to coordinate care, manage risks, and ensure clients can remain safely at home. But in most organizations, nurses are employees inside that structure rather than the people designing it. So nurses see the clinical side of home care every day, but not necessarily the business model behind it. Once you start understanding how home care programs and services are structured, you begin to realize something interesting. The knowledge nurses already have is incredibly transferable into running a small, well-structured home care service business. Nurses are actually uniquely positioned to run a home care business. You already understand clinical risk. You understand documentation and compliance. You understand multidisciplinary teams and how different services fit together. And most importantly, nurses understand what safe care actually looks like in a person's home environment. That clinical perspective is incredibly powerful when designing services that truly support independence. In many cases, when nurses lead home care services, the focus naturally stays where it should be, on quality care, prevention, and good client outcomes. And that's why nurse-led services can work extremely well in community care. When nurses first start thinking about building their own service, it can feel like a huge leap. But in reality, the transition usually comes down to understanding a few key areas. The first is provider structure, how home care services are set up legally and operationally. The second is service delivery systems, so care coordination, clinical oversight, and support workers operate smoothly together. And the third is building a small, sustainable client base where quality of care remains the priority. When those elements are structured well, nurses often find they can create services that are both professionally fulfilling and sustainable long-term. Demand for home care is increasing rapidly as more people choose to receive care in their own homes rather than institutional settings, and nurses will continue to play a critical role in making that possible. But the real question is this: will nurses continue working only inside systems designed by someone else? Or will more nurses start stepping forward to build and lead services themselves? Because the reality is, many of the skills required to run a high-quality home care service are the same skills nurses are already using every single day. If you're a community nurse watching this and you've ever thought there has to be a better way to do this, or if nurses designed these services, things would look very different, then you're not alone. There actually is a clear pathway for nurses who want to move from employee to provider. If you'd like to learn more about that pathway, just comment nurse below. I'll send you the Clinical Founder Roadmap, which explains how nurses are starting and building their own home care services. And if this video resonated with you, make sure to like and subscribe for more content on career growth and leadership in community care. Thanks for watching, and I'll see you in the next video.